And talking about guys, I wanted to get into some of the men's services just because uh, just on my page, that's the biggest thing is the girls always complaining about their guy, and one of the first things that I have here is the P shot. And the question that I have, what is the P shot and does it actually work? And what are the benefits a guy can get from this?
The P shot stands for the Priapus shot. And what we use is platelet-rich plasma, PRP. So again, we draw blood, we spin it, separate your red blood cells, we get your plasma. Again, in that plasma is platelets, growth factors, your own stem cells. The process for the P shots is we numb the patient. We apply topical numbing, which is very, very effective. I feel nothing. So they're numbing while we're spinning and getting everything ready. And then there are 5 injection points. So we inject the shaft, and then we inject the glands on the head of the penis. And what that does is it regenerates the tissue, and it promotes more blood, more circulation to the area. So we're actually getting more vascularization. And over time, you get stronger erections, harder erections, longer lasting. Some men, they complain of lack of sensitivity. So it kind of aids in that as well. So usually I have guys that'll come in with concerns of ED, and the P shot is one of the things in the treatment protocol that we recommend. And then there are guys who are fine. They have no concerns, but they know how important prevention is. So they kind of get ahead of the game. They'll come in once a year to get a P shot. And that also gives them performance enhancements. Also, when you do the P shot, I never guarantee this to my patients, but there's a possibility that you'll see some increase in girth from the P shot.
So a follow-up to that is, how long does it last? Like, is it something you have to come in like every 6 months, 3 months?
It's recommended to do it once a year, unless there is a real concern or something like more severe going on. But normally, it's recommended to do it once a year. The nice thing about it, there's no downtime. As soon as the numbing wears out, which is within a couple of hours after the procedure, I tell my patients, there's no downtime. You can go home tonight and have sex. I actually encourage it.